I'm going to perform hand hygiene, provide her with some privacy. Hello, my name is Anisha. I'm going to be your nurse today. Can you identify your name and date of birth?
My name is Denai Johnson, and my birthday is 06/21/2000.
Okay. I verified that. Now she knows who she is. Do you know where you're at?
I'm at the hospital.
Do you know why you're here?
Yes, I just had a baby a few weeks ago. So.
Okay. Do you know what year it is?
2022.
Okay, good. Now I'm going to educate you on this incentive spirometer. You're going to use this 10 times every hour you're awake. You see this little meter right here?
Mm-hmm.
You're going to try to get it higher every time. It's basically just going to help with preventing pneumonia and help your lungs not collapse. Okay. Have you had any falls in the past 3 months?
No.
Do you use a walker?
No.
Do you take any daily medications?
No.
Okay. Now I'm going to educate you on the Braden scale. You can be at risk for skin breakdown if you have poor nutrition, too much friction and shear from laying in the bed too long, or mobility. And you probably don't have any problems with that, so that's good. Now I'm gonna check your scalp, make sure there's no dandruff and you don't have any. That's good. Your hair is evenly distributed, so that's good. Now I'm gonna check to make sure your head is symmetrical and round, and it's not. Your smile is even, so that's good. Now I'm gonna check your ears. Can you pull your hair back for me?
They might not be that clean.
Okay, well, they look good today. Okay, let me check the other one. Do you have any problems with hearing loss?
No.
Have you ever wore a hearing aid before?
No.
Do you have trouble with headaches?
No.
Okay. Can you go like this and breathe in and do it on the other side? Just testing the patency of your nose, making sure it's open. Have you had any trouble with sinus or drainage? Okay. I'm going to look in your mouth. Just say ah right quick. Okay. You don't have any lesions or anything in your mouth. That's good. Do you have any trouble with a sore throat?
No.
You said you don't have any headaches, right?
No.
Okay. Can you swallow for me? Haven't had any trouble swallowing, have you? Okay. Doesn't seem like it. Can you remove your glasses right quick for me?
Sure.
I'm going to shine this bright light in your face. This is just testing to make sure that your pupils dilate. Just look straight ahead. I'm going to test the other side. It went from a 4 to a 2, so that's good. Can you get your eyes to follow my fingers? Look up, down, side. Her pupils are equal, round, and reactive to light and accommodation, so that's good. You said you haven't experienced any vision problems, right? Do you wear glasses or contacts?
No.
No. Now I'm going to educate you on the Glasgow Coma scale. The worst being a 3 and 15 being the best. It has 3 parts: eye response, motor response, and verbal response. You have good eye response. You're talking back to me, so you have good verbal response. So you have good motor response. I'm gonna check your neck. Can you? Yeah. Other side. You don't see any veins, so she doesn't have JVD. Okay, now I'm gonna listen to your heart sounds. I'm listening to her first intercostal space and her aortic valve. Then I'm going to move over to her pulmonic, then Erb's point, then tricuspid, and the mitral valve is mid-clavicular line. Ma'am. And we listen right here. For her apical pulse as well. Then we flip it over to check for heart murmurs. Now I'm going to listen to your respiratory sounds. Is that okay? And I'm going to start in her right upper lobe. And then I'm going to move over to her left upper lobe. And then I'm gonna move back over to her right lower lobe and listen. And then I'm gonna listen on her left lower lobe. Can you sit up for me? Cross your arms. And then I'm gonna listen to all 4 points on her back, her left lower lobe, her left upper lobe, her right upper lobe, her right lower lobe, and her left upper lobe, left lower lobe. Now you can lay back. Now I'm going to be checking your arms for any edema. I don't see any. Let me see the other arm. Her hair is, I don't really have any. Her hair is evenly distributed on both arms, so that's good. I don't see any scars or lesions on her arms, so that's good. Now I'm going to test her capillary refills. And they're less than 3 seconds, so that's good. And then on her nails, I'm going to be checking for color, making sure they don't curve, and the firmness of her nails. And I'm going to go ahead and check her radial pulses on both arms. They're bilaterally even. It's about a 2. Now I'm going to be checking. Can you lift this up a little bit? That's enough on the other arm. Lip. Now I want to be checking for edema on her legs. She doesn't have any. That's good. Her hair is evenly distributed on her legs. She doesn't have any scars. Oh, you got one right there. Where they came from? Oh, for real.
Something beat me.
Oh.
An ant.
She has a little scar from an ant bite. That's fine. I haven't had any problems with it. No. It's healing. Okay. It's healing good. Now I'm going to check her pulsites, her doralis pedis on this side. They're about laterally even. It's still a 2. Then I want to check her pulsites on the inside here. That's the posterior tibial. That's a 2 as well. And now I'm going to go back up and check her. Have you experienced any numbness or tingling in your hands or feet?
No.
Okay. And now I'm going to go back and do her abdomen, her GI. Now I'm going to do her abdominal assessment. First, I'm going to look. Let's pretend like her shirt is up. I don't see any lesions or anything, and that's good. Can you point to your belly button? Okay. I'm going to start in her right lower quadrant. You can move. And I hear bowel sounds, so I move on to her right upper quadrant. I hear bowel sounds, so I move on to her left upper quadrant, then move to her left lower quadrant. All her bowel sounds are normal active, so that's good. Then I'm going to palpate in a circular motion. Do you feel any tenderness?
No.
Okay. Do you feel any burning when you urinate?
No.
What color is your urine?
It's yellow.
What kind of yellow?
I go bright yellow.
Okay, that's good. Does it have any odor?
No.
Are your bowel movements regular?
No, I have IBS.
Okay. What do your bowel movements usually look like? Are they soft formed, hard, or loose?
Pretty normal. Kind of solid, but not hard.
Okay. Well, now I'm gonna do your range of motion exercises. Can you flex your elbow and extend it? Do this one too. Okay, now try to flex it. Now try to flex it. You know you're stronger than me. Don't do all that. And now try to extend it. Like push against my arm. Push against my arm. We're just testing the resistance. Now, with your wrist, flex your wrist. and extend your wrist. Now flex your wrist. Now extend your wrist. Okay. Now I'm gonna do your ankle. Flex your ankle and extend it. Now flex it and extend it. And I would do the other side. But the way my bed's set up, I'm not doing all that. Now, can you sit on the edge of the bed? We're gonna do range of motion on your knee. Now flex your knee. Extend your knee. And flex it, relax it. Do the other side. Now extend your knee. Extend. Flex. Flex. Yeah. Now I need you to stand up. I'm just going to be testing your balance. It's called the Romberg's test. Just try not to, do this. So that's good. You didn't sway. Now I'm going to ask you to walk regularly. Now come back and walk heel to toe. You can have a seat. Okay, I think this completes our assessment for today. Thank you. It was a pleasure being your nurse today, and the doctor will be in shortly.